And then sometimes if there's rotator cuff injuries, this sort of movement is pretty precarious because the shoulder is a fairly shallow ball and socket joint. So to release tension, what we're going to do is squeeze. If we just pull a muscle, the muscle's job is to like, what we want to do is get circulation into it first and then go in for the stretch. So we're going to squeeze our right shoulder up like we're trying to crack a nut between our neck and our shoulder, because that's convenient. Try to make sure your jaw is soft, and then gently relax that, but allow it to totally relax. Now engage your pecs on that right side and draw that right shoulder forward. And it might, one or more of these positions might feel really awkward. And then relax. Then suppress that shoulder down. And it might feel really tight. This one's super tight on me. And then smile. And release. And now adduct that shoulder towards the spine. So you're drawing the shoulder blade, squeezing it close to the spine. Make sure your jaw is not helping you because it's not helping you. And then relax. Good. Then up, forward, down, back, up, forward, down, back. And now let it be more fluid, like you're doing a circle. And then we're going to take it backwards because that's just a little sassier. Good. Good. Then sitting up nice and tall. If you don't have rotator cuff injuries or you don't get pain when you do this, slide your hand, your right arm behind your back, the forearm. Roll that right shoulder down and back. Inhale, lengthen through the crown of the head. And then exhale, bring your left ear towards your left shoulder. Good. But keep that left shoulder relaxed. Good. From here, you could move the head a little forward and then a little back, just noting if there's any muscles in here that feel tight. And for me, sometimes I even get tight up underneath my jaw, so when you bring your head back, you could even lift the chin slightly. And anywhere along that way, if you find a tight spot, feel free to stay there and breathe into it. Now line your left ear back up in line with the left shoulder and turn your chin towards your left armpit. Take an inhale, and then the next time you exhale, let the chin slowly slide into the middle of the chest. Release that right arm from behind your back. Then with an inhale, lift the head up. And just pause for a moment and see if you feel a difference between each side of your shoulder girdle and each side of your neck. Good. Anyone notice? Good. Okay. We're just going to do the one side tonight and we'll get, just kidding. Okay, sit up nice and tall. Squeeze the left shoulder up like you're trying to crack that nut again. Really squeezing, but don't let the jaw help you. And then relax. And then you're going to engage the pecs and draw that shoulder forward, protracting it. And relax. Then suppress it down. My trick here is to not let the other side help. And then relax. And then draw that left shoulder blade towards the spine. Good. Make sure you're not holding your breath. I usually know it because I'm doing it. That's how I figure it out. And then relax. Now we're going to go up, forward, down, back. Up, forward, down, back. And now let it get more circular. Good. And then reverse it. Good. Okay, now we're going to roll that left shoulder down and back. If it feels okay on your shoulder, you're going to slide your left forearm behind the small of your back. Roll the left shoulder down and back. Inhale, lengthen through the crown of the head. And as you exhale, bring the right ear towards the right shoulder. Maybe noticing, we tend to have a lot of asymmetry, especially in the shoulders, depending on our use. And then if you would like, you can start to explore moving the head slowly forward and back. Keep breathing into the tension as though the lung is sitting in the tension. Maybe even as your head comes back, lift your chin slightly, see if that releases any tension around the upper neck or jaw. Now lining that right ear up in line with the right shoulder. We're going to turn the chin towards the right armpit. And then do some gentle nodding of the head there. The next time the chin comes down, let it roll all the way into the middle of the chest. Release your left arm out from behind your back. And then with an inhale, lift the head up. And then exhale, turn your head towards the right, just to make sure we still can. Then inhale back to center, always lengthening through the crown of the head. Exhale, turn your head left. Good, then inhaling, coming forward. Good, then just a little bit of shaking the shoulders, doing some non-linear movement. Yay. Undulating.